topic in our talks about diabetes type 2 and Ayurveda will be neuropathy, especially diabetic neuropathy. What is it? Long-lasting diabetes can lead to damage of the very fine nerves which are ending in the fingers, in the feet,
yes.
By that leading first to some numbness, mostly like a shock, we call it, loss of feeling.
Yes.
Later on there can be pain, which is very nasty. There can be restless legs syndrome, we call it, that people have restless legs night when they go to bed.
Sleep,
And slowly this neuropathy can also impair autonomic function, is controlling our involuntary body functions, like how fast our heart is beating, our bowel functions, our sexual functions, sweating, our pupils, all these things are controlled by that. And if these functions are impaired, big problems also can be the cause for the patient. For instance, erectile dysfunction, dryness of the vagina, bowel problems with diarrhea or obstipation, and also problems with the heart.
The heart eurythmic problem as well.
So it is very important to control diabetes to avoid this autonomic disturbances.
Definitely, yes.
What can Ayurveda offer in this respect?
So, Dr. Garner, as I always said again and again, that it's important that we keep our HbA1c level in diabetes at 7, maximum 7.5 all the time. And for that reason, it is important to do diabetox treatments once in a year, and if possible, if not 1 year, at least once in 2 years, as a maintenance program for metabolism and sugar management. So this will work at a grassroots level and keep the blood sugar always under control and prevent any ill effect of diabetes on the nerves or the eyesight or heart and different organs. So this is the first fundamental thing. In case if somebody has impacted, like in India especially, people describe these symptoms that as if when they walk, they feel as if they are walking on the sponge.
Right.
That's a typical word they use, or they are walking on the water. So that's an extreme sign of neuropathy in the feet and tingling and everything. If somebody is impacted, then two things are very important. First, improve the circulation by giving Suhridai. Suhridai contains Arjuna, Gugul, Rasna, Draksha, many such herbs which are actually proven scientifically to clear the clogged arteries if taken on long term, like 6 months, 1 year. If somebody take it for a long period of time, then they are proven scientifically that slowly and steadily they clear the arteries. The small
function can come back also.
So this is the first thing. So we have to work on first on the reason. The first reason is that the small capillaries got clogged and the blood supply was impaired.
And by that, the small nerves did get no nourishment, and by that
then they got damaged. So first thing is they clear the blood supply. The second point is nourishing of the nervous system. There are a lot of powerful herbs, scientifically proven. At Ayushakti, we have seen on scientific parameters that certain herbs like Bakupa muniera, in Sanskrit they are known as Nirabrahmi, Vidania somnifera, which is known as Ashwagandha, and Jatamasi, and Centella asiatica. These are the herbs which, if taken on long term, like 6 months, 1 year, 2 years continuously, they nourish the nervous system, and slowly they revive the nervous system. So this is the second action. The third action is anti-inflammatory, because when the nerves are damaged, besides damage, they also sometimes get inflamed. and that's why they don't function very well. So inflammation is one thing that if you keep under control, then everything remains very well.
Can be improved.
Can be improved, So Gokshur, for example, Punarnava, Vayavarna, Gugul, these are some of the herbs which are scientifically proven to show the anti-inflammatory effect.
Concerning diet, it is the general rule you say, or there is something specific for the autonomic nervous system?
Besides the diet which we always advise for blood sugar control, one should also focus on taking things which are good for circulation. For example, cooked broccoli, spinach, Brussels sprout, kale, Swiss chard. These are the vegetables which are very, very good for blood circulation. They should be taken, if possible, every day, so that slowly, slowly the clogged arteries become clear. Then certain vegetables like artichoke, then white pumpkin. In India, it's known as kaddu, okay, safed kaddu. So that one, or zucchini. These vegetables have impact on reviving and renewing the nervous system. So I recommend everybody, especially this Indian vegetable, white pumpkin, if possible, drink half a glass of white pumpkin juice every day when there is neuropathy. And this helps prevent Alzheimer, memory loss and neuropathic changes also.